Chapter 2 is looking into the settings and models presently used in the nursing care. And it's obviously that the healthcare environment nowadays is it's very dynamic, and it's kind of challenging the traditional roles and responsibilities that the healthcare providers and the institutions used to carry back in the day. Um, Both the clients and their family members nowadays have a say in the healthcare. They can manage, and with the support of visiting nurses, may treat conditions and treatments that perform treatments that until not long ago they were possible to be performed only in very special type of units. Procedures that formerly required clients to be hospitalized for at least a week nowadays will be done in very short stays and sometimes even less than 24 hours. So, in other words, no matter of what is the setting or the circumstances, the current healthcare will mandate that the nurse to be able to provide high quality services wherever those are needed. And nurses are asked to function in both traditional and in now developing and evolving type of roles. Please take a moment and review the learning objectives for this presentation, and if needed, stop the presentation to review them. We'll start by defining nursing care. And if we need to define nursing represents that concern caring for individuals, families, or groups. The nurses are those professionals caring for clients not only when they are ill, but also being involved in their education, health-related education, and their illness prevention and promotion. Nurses will be the individuals, will be the professionals that are tending to the client needs, and they will include all of those. We'll look into the hygiene and activity and diet. They will evaluate their environment, medical treatment, physical, emotional, and spiritual comfort. So this brings us to how can we define nursing? So in 1859, Florence Nightingale was describing the role of the nurse as, and I quote, the person that will put the patient in the best condition for nature to act upon him. A little bit later, we had some other theorists that will change a little bit the definition. And in 1966, Virginia Henderson will define the nurse as the person that will assist the client to carry out those activities that they will perform and will not be able to perform unaided because they don't have the strength, the will, or the knowledge. In 1980, another theorist, which is Dorothea Orem, will say that nursing care is directed at restoring self-care abilities, those activities that the client initiates on their own behalf in maintaining health, life, and well-being. Keep in mind that our program's main philosophy revolves around the Dorothea Orem's theory of self-care. In 1976, Sister Callista Roy will say that nursing encourages clients to reach their highest level of functioning throughout adaptation. So in her eyes, the theoretical link was the adaptation. In 1988, Jean Watson described it a little bit different, and she said that nursing is the science of human caring to help patients reach their greatest potential. We are coming back to our modern times, and if we are looking into the definition that the American Nurses Association is given to nursing in 2017, this sounds like this. It is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, facilitation of healing, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, groups, communities, and populations. So it is obvious that there's a wide range of activities that the nurse needs to perform. So we'll start with the obvious and most common one, which is the physical exam and taking the health history. The nurse will also be that will be involved in providing health promotion and counseling and education. Will be involved in administering the medication, will do the wound care, and a lot of other personal interventions. Will be the person that will translate to the patient the information and will help them, will be there for the patient when they need to make critical decisions. Will be direct and supervise the care delivered by other healthcare personnel, especially those that are nurse aides or unlicensed assistive personnel. And nurses, not the last but not the least, they will be conducting research in support of improved practice and patient outcomes. Now, after presenting you all those elements, all those responsibilities that the nurses will have, let's look at the roles a little bit. What will be the nursing roles? And definitely we have different types of nurses with different level of education that will perform in a variety of setups. Let's look first at the licensed practitioner or vocational nurses. Those are the nurses that provide care to clients under the direct supervision of a registered nurse, of an advanced practice registered nurse, a physician, or a physician. So the care that the LVNs, LPNs are providing, it's well defined, and usually they are looking into the chronic condition or the normal development of an individual. The RN role is a little bit more complex and involves the management and coordination of all the care provided to a whole group of clients. What will be the setup? What will be the healthcare settings where the nurses are performing? So again, that can be a variety of setups. We can have length, depending, we can classify them based on their length of stay. And if we are looking at this, from this point of view, we have what is called an in and out type of care. And usually the interaction with the patients in those setups are minutes to hours. The typical example, it's an office visit, an emergency department visit, or any type of therapy sessions. We have short stay that will provide care to those that have an acute condition or they need treatments that are not, they do not require more than 24 hours of care and monitoring. Usually those are the diagnostic test setups or invasive surgeries. We have the acute care, which traditionally occurs in hospitals. The patients may stay 24 hours, however, less than 30 days. And we have long-term care that will provide the care for residents that may be over there for the remainder of their lives, or they have a need for a recovery that takes between at least 30 days and most of the times will reach 90 days. So the hospital will employ all levels of nurses in outpatient care areas. There will be dialysis units, clinics, same-day surgery units. They may have inpatient units. Now, if we are looking at the type of the ownership of the facility, we have those that are called government-owned or public facilities that receive at least some tax support for costs and are governed by federal, state, or local governments. As an example, those will be your VA hospital, mental health facilities, or visiting nursing agencies. You may have what is called a proprietary agency, and this is referred as a for-profit agency. They are owned and operated by corporate groups that have investors and stockholders. As an example, you have the Humana Incorporated for healthcare facilities, or they may be non-for-profit agencies that are owned and operated by non-profit groups, such as universities or religious organizations. The term non-profit means that any income that exceeds their operating and maintenance costs is used for the growth inside of the facility and is not distributed to the stockholders. Just for you to understand, a nonprofit agency doesn't mean that they are not looking for the money, or they can waste the money, or they are not interested to make more money. They are not distributing them to stakeholders. They are just using it for their own growth inside. We're looking now into acute care types of facilities. So whenever we are describing how acute a condition is, we refer to the term acuity. That refers to the gravity or the degree to which a person's condition changed. A higher acuity is a client with a severe illness and whose condition can change critically and rapidly. As a general rule, a higher client acuity will require a greater need for a highly skilled care. Clients that have complicated or high-risk surgeries, massive trauma, critical illnesses will be taken care of in acute care hospitals that have a high level of professional and skilled personnel employees. Usually in acute care setups, you'll find a lot of registered nurses. Another type of setup of acute care is called long-term acute care. And in here, the clients may need long-term wound care or ventilator support, and they do have conditions that are potentially unstable. However, the condition, despite the fact that it's unstable, may not change rapidly and massively like in an acute care setup. In general, the clients that are discharged from an ICU but still require some higher level of care will be transferred to a long-term acute care facility. Again, in those type of facilities, you may have all kinds of licensed and unlicensed personnel. However, the registered nurse is the manager of the client's care. The subacute facilities will refer to that care that is a little bit more intense than the traditional long-term care. However, it's less intense than the acute inpatient care. That's the reason for the subacute term. In general, the clients in those facilities will stay for a brief period of time, not more than 30 days. Some of those facilities may allow the patients to stay up to 90 days, and while the client's care is coordinated by RNs, again, LVNs and LPNs, together with other unlicensed personnel, may provide care in those facilities. Question number 1. A nurse is caring for a client who has been admitted to the hospital. What service is a priority for a nurse in the acute hospital setting? A. Helping clients with rehabilitation after a stroke. B. Working closely with the client's caregivers. C. Helping clients to achieve maximum level of functioning. Or D. Working to stabilize the patient during an acute illness. The correct answer is D. Working to stabilize the client during an acute illness. And the rationale is the fact that in a hospital setting, the nurse will be an acute care setup. The nurse will work to stabilize the patient during the acute phase of the illness. We are looking now into other types of nursing care setups. And we refer now to the skilled nursing facilities. Skilled nursing care will provide skilled nursing and rehab care to patients that have the potential to regain a function, but still need some type of skilled observation and nursing care after an acute illness. The clients in those facilities, they may require different types of therapies, and they may require, through their presence over their invasive procedures, they may have feeding tubes, IVs, they may need a sterile dressing change as wound care. Again, the registered nurse will be in charge of the client's care. However, the LVNs and LPNs will work under the supervision of the RN. Intermediate care facilities are nursing homes that will provide custodial care for people that are not able anymore to care for themselves due to either mental or physical disabilities. In order to be admitted in an intermediate care facility, the client will have to meet specific criteria related to their inability to meet their own activities of daily living, or ADLs. Intermediate care facilities do not receive reimbursement from Medicare because they are not considered medical facilities. In those facilities, LVNs, LPNs, and nursing assistants will provide care, again, under the supervision of a registered nurse. And now let's talk about rehab centers. So rehabilitation centers will provide, obviously, rehab care that provides physical and occupational therapy for clients in order to help them regain as much independence with ADL as possible. Again, the LVNs and LPNs will perform the care, provide the care in those setups under the supervision of a registered nurse. Other types of nursing care settings will include the hospice, and in the hospice category or hospice care, you will find the terminal ill clients that have a life expectancy that is less than 6 months. Inside the hospice care, the terminally ill client will be able to and helped and supported to live as fully as possible while their pain and discomfort and any other symptoms are managed all along. Those facilities are managed by and supervised by a registered nurse that in addition has special training in helping family with a grief process. Ambulatory care refers to the outpatient care mainly, and there are a wide range of outpatient setups that will fit into this category as diagnostic centers, like a gastroenterology center where you're just doing a colonoscopy, daycare surgeries, medical treatment centers, all of those like medical therapy treatments like a dialysis center, all those will fall under the category of ambulatory care and will be managed by RNs or LPNs depending on the services that they are providing. The home care, it's a continuous trend in the last 20 years of providing more and more home healthcare services. And those home care services will include both long-term and short-term health needs, and they have, most of them, a very comprehensive way of covering it. They can provide specialized care up to IV infusion of fluids, medication, and chemotherapy, hospice care, post-cardiac care, and even ventilator-dependent care. Based on their specifics, usually an RN will manage and coordinate the care for the clients, and depending on their level of competency in the assessment skills, communication, and management. Last but not least on the list will be the community health centers, and those are places that provide a range of services to several districts or counties or communities that they serve. They will receive partial or complete funding from either federal, state, or local governments. A good example is the community mental health centers that are part of this type of setup. Question number 2. LPN, LVNs are now working in ambulatory health clinics, hospice settings, and homeless shelters and clinics. What has influenced this increase in practice settings for nurses? The options are A, population shift to more rural areas, B, shift of healthcare delivery into the community, C, introduction of primary care clinics, D, increased use of rehabilitation centers. The answer is B, shift of healthcare delivery into the community. As healthcare delivery shifts into the community, more nurses are working in a wide variety of community-based settings. And those settings may include public health departments and ambulatory health clinics, long-term care facilities or hospice settings, industrial settings as occupational nurses, or in educational system as school nurses, homeless shelters and clinics, nursing centers, home health agencies, urgent care centers, same-day surgical centers, and short-stay facilities. Wide range of setups. So as a home health care nurse, the nurse is in charge of assessing the client and consulting with the physician. By teaching, is in charge of teaching the client as well as the family and how to perform certain procedures and how to monitor, identify, and respond to a wide range of symptoms at home. they are also evaluating and changing the home environment to make it safe for the client. And they are also educating and bringing in the community resources to help the client. What would be some alternative healthcare settings? So in addition to all those community-based settings, we have a different category that is called an alternative healthcare setting. And those will include the congregate housing, boarding homes, assisted living facilities. So what are we'll describe each of those. What is the congregate housing? This type of healthcare setting will provide independent living for seniors or disabled adults who require minimal to no assistance. They are freestanding apartments or private rooms or a combination of both, and the residents need to meet certain qualifications in order to be allowed to join one of those type of facilities. Some congregate housing centers will provide also services such as serving one or more meals per day in a common dining room or offering recreational activities. In general, they are very affordable. Residents may not have, especially because the residents may not have any other resources to purchase extra services or goods. The boarding homes usually are small homes with individual rooms where the residents will pay for the room and board and will receive minimal nursing services. In some cases, the residents may share the rooms. Usually, those kind of boarding homes will have a common dining area for all meals. And the boarding homes will oversee employment for disabled adults and provide a stable environment for those that cannot live independently. In this type of setting, the residents will receive the needed supervision, but may relinquish some independence and privacy along the way. Assisted living facilities will provide care to residents who require assistance with up to 3 ADLs. Residents will maximize their independence in a setting that maintains their privacy and dignity. These facilities are not regulated as long-term care facilities, and there are some concerns that the quality of care is not at the level that the Joint Commission will expect that to be. There is a voluntary accreditation process that was developed by Joint Commission for those assisted living facilities in order to make sure that there is a consistent level of quality of care delivered. In most of the instances, the assisted living facilities are quite expensive, and the residents must provide a large upfront investment. And after that, they will need to provide monthly fees. Question number 3. Which type of alternative healthcare setting provides care to residents who need assistance with multiple activities of daily living? A. Boarding homes. B. Assisted living facilities. C. Congregate housing. Or D. Community health centers. The correct answer is B. Assisted living facilities. The facility may or may not provide services as housekeeping, laundry, transportation, and meals, and the residents can maintain a lifestyle more similar to that which they previously enjoyed. Last aspect that we will describe today will be the models used during the nursing care delivery. And the delivery of nursing care have been structured in a complexity of different ways throughout the years. And we'll describe a few of those types and a few of those models and we'll try to compare and contrast them a little bit. We'll start with what is called the case method. And historically, that's the way that the nursing care was provided. The nurse will provide the services that are particularly needed or required by a client. In some cases, the nurse may accompany the client to the hospital if necessary, will provide care in home, or and even perform some of the household duties as well. In the modern times, the method and the care becoming more complex, this method becomes a little bit impractical. And different models for the hospital-based delivery of nursing care also evolved. A modern version of this case method is the private duty nursing that is whenever someone can afford that can be used. Another type of model is what is called the functional nursing, which is instead of being focused on the patient, is focused on the task. It's a task-oriented method that evolved during the late 1930s. In the functional nursing, the distinct duties are assigned to a specific personnel. For example, one nurse takes all the vital signs while someone else is making the beds, while another one will do the dressing changes, and so on. So in the setup of a facility, the tasks will be divided and the clients will be involved and see several people during the day. It is very efficient. However, the delivery of the healthcare is a little bit fragmented and it can become confusing for some of the clients. Another model is called the team nursing, and that started in the 50s, and it's a response to what I was telling you that happened with the functional nursing, that it was too fragmented. And in this model, the staff with varying levels of education and skills will be accommodated. In this team, you will have an RN, a registered nurse team leader. You may have other RNs, you may have LPNs, LVNs, and nursing assistants, all of them providing care to a group of clients. The team conferences allows for discussions and development and implementation, discussing how to implement the care plans. And another model will be the total patient care. The total patient care will have an assignment in which a nurse assumes all the care for a small group of clients. In this case, the method focuses more on the client and less on the tasks. Total patient care is probably, as an example, most commonly seen in ICU delivery of care. Other types of other models, primary care nursing. Well, in primary care nursing, usually a registered nurse will assume 24 hours accountability for the client's care and has total responsibility for all the nursing care that is assigned to her throughout her shift. In this type of model, the secondary nurses will carry out the plan of care in the primary nurse's absence. In this approach that was initiated in the 70s, it has its own disadvantages. And because it's a little bit expensive and it relies entirely on RNs. On the other hand, this model has some advantages. And one of them is that the client has a caregiver that is consistent. The patient sees one person and is perceived as holistic and receives a holistic and comprehensive care. The partnership model. The partnership model will include this is the method where usually a registered nurse will partner with one or more assisted personnel to care for a group of clients. The RN may work with LPNs or an assistant, with a respiratory therapist or an assistant, and any kind of other similar combinations. The RN usually has a role in resource management and it's accountable for the outcomes of the nursing care. Let's discuss now what is the case management model. Well, case management is not a model of primary nursing care. Case management maximizes the fiscal outcomes without sacrificing the quality by a careful oversight of a client's healthcare. In other words, the person responsible for overseeing the client's care, which is usually an RN that has a bachelor or a master degree, is called a case manager. In some specialized settings, a case manager may have a very specific group of clients, like patients with renal failure or patients with diabetes or pediatric population with special needs. The insurance companies and hospitals will employ those case managers, and usually they will have a caseload of 15 to 25 clients depending on their degree of illness. Not every client will have an aggressive case management. Only those that are very sick, may experience complications or have chronic illnesses. The case manager will follow the client when they are scheduled for admission until the day of discharge. They follow the evolution of the client while being in the facility. An insurance-based case manager will also maintain contact with the client, especially for those with chronic illnesses when they are at home. Case manager usually will use tools as clinical pathways by using protocols to guide treatments and measure outcomes, practice guidelines and standards of care, and all those elements will help them planning and coordinating the care needed for that specific individual. You can see here flow chart for a case management. You can see that the nurse case manager has some essential functions, including assessment, planning, coordinating, organizing, resource allocation, implementation of care and evaluation, and will collaborate closely with the physician, with the client and the family, with any type of ancillary services, as well as with the primary nurse. Question number 4. Which of the following statements is an accurate description of case management? A. Case management has been a traditional role for nurses. B. Case management hinders care quality. C. Case management optimizes fiscal outcomes. Or D. Insurance companies employ case managers, but hospitals do not. The correct answer is C. Case management optimizes fiscal outcomes. And the rationale is because case managers will plan and coordinate the entire client's progress through the diverse phases of care in order to avoid any delays, unnecessary diagnostic testing, and the overuse of any type of expensive resources.